when you want to access the kidney, there are certain important layers that we might have to go through. Okay, so usually when we access, we usually go via a flank incision. So when you go via a flank incision, one important structure we would encounter, flank incision, you find that if you place it very high up, there is a very high chance that you could injure the pleura, because you can see that the upper pole of the kidney seems to be closely related to the 12th rib on the right side and 11th and 12th rib on the left side, and the pleura seems to be coming in between here, between the 11th and the 12th rib. So the pleural injuries are very common, not only during open renal surgeries, but very important during certain percutaneous renal surgeries, including PCNLs, which is done for stone disease. So this is an important point to be noted, the relation of the pleura to the kidney. So the pleura always comes, one lip of pleura comes between the 11th rib and the 12th rib. So hence, approach to the kidney, especially by percutaneous route, should be done under careful monitoring, not to penetrate the pleura or injure the pleura. Okay, and this is particularly important with PCNLs and nephrostomies. The approach to a kidney is not only via the flank, it can also be done posteriorly. So posteriorly, when you approach the kidney, there are certain layers that you would encounter. So first would obviously be the skin, second is the superficial fascia, the third layer would be the muscle layer. So the muscles you would encounter would be the latissimus dorsi, as you can see here, the serratus posterior, the inferior component of the serratus posterior. So after serratus posterior, you will also encounter the posterior layer of the thoracolumbar fascia as you come medially. Once these layers are encountered, deeper to that will be the erector spinae. Deep to the erector spinae would be the middle layer of the thoracolumbar fascia. So this will be the middle layer of the thoracolumbar fascia. Deep to the thoracolumbar fascia will be your quadratus lumborum, and deep to the quadratus lumborum will be the anterior layer of the thoracolumbar fascia. So once you penetrate the anterior layer of the thoracolumbar fascia, you will reach the pararenal pad of fat, beyond which you will encounter the renal fascia. Posteriorly, when you go, you encounter the posterior rail of the renal fascia, which is called as the fascia of Zucker-Candle, and then you will encounter the perinephric pad of fat, and then you will encounter the renal capsule. So when you go from posterior, these are the layers you will encounter. To summarize again, when you go from posterior, you will encounter the skin first, superficial fascia. Deep to that will be the muscles. The most important muscle will be the latissimus dorsi and the serratus posterior, as well as you will encounter the posterior layer of the thoracolumbar fascia. Deep to that will be the erector spinae muscle. Deep to the erector spinae muscle will be your middle layer of the thoracolumbar fascia. Deep to the middle layer of the thoracolumbar fascia will be the quadratus lumborum muscle. Deep to the quadratus lumborum will be the anterior layer of the thoracolumbar fascia. When you go beyond the anterior layer of the thoracolumbar fascia, you will enter into the pararenal pad of fat. So when you approach from posterior, these are the layers you will encounter. Now the blood supply of the kidney. Kidney receives its blood supply from the renal artery, which is given off at the level of L2. Like I said earlier, renal artery is a lateral splanchnic branch of the developing aorta, given off at the level of L2. The renal artery divides into an anterior and a posterior division. As you can see here, it has an anterior division and a posterior division. The anterior division is said to be much thicker than the posterior division. This anterior division again divides into 4 anterior branches, and the posterior division gives rise to 1 branch. Based on this, we can divide a kidney into 5 vascular zones. So you can have the apical zone here. You have the posterior zone here, upper, middle and lower. So you have the apical zone here, you have the posterior zone here. This is the upper zone, middle and the lower zone. So this is very important, and because you find that each segment has its own branch which supplies it. In between the posterior segment and the anterior segments is this avascular plane called as the Broddel's line. So this Broddel's line is very, very important when you are planning for a calculi removal when you're doing an open calculi removal, particularly in the case of a staghorn calculi. So this Brodel's line is a watershed area between posterior as well as the anterior vascular divisions or vascular segments of the kidney. So you have vascular segments include apical segment, and the anterior segments are divided into upper, middle and lower segments. Then you have one large posterior segment. So in between the three anterior segments and the posterior segment, you have the Brodel's line.